Hello, I am Dr. Aizaz from MedicoVisual.com. Welcome to this visual lecture. So in the last lecture, we had developed this structure from the intra-embryonic coelom. I'm not gonna go into details that how it develops. If you want to understand that, please watch the previous lecture. So in this diagram, this structure is the primitive. This structure, this space, I should say, this cavity is the primitive. It is not definitive, it is primitive pericardial cavity. This is primitive pericardial cavity, and then this one is the primitive. This cavity is what? This is primitive peritoneal cavity. Primitive peritoneal cavity. Then in the last lecture we also discussed that between these two cavities are the bilateral, I mean the paired canals here. What are these paired canals? These are behind the septum transversum. So this is septum transversum. So these cavities which are dorsal to septum transversum and lateral to GI tube and its mesentery. These canals, these are the bilateral canals. These are connecting the primitive pericardial cavity to the primitive peritoneal cavity. So what should be the name of these canals? The name of these canals is, logically, they are called the pericardio, because at one end they are connecting the pericardium, pericardial cavity, pericardioperitoneal. They are connecting the pericardial cavity with the peritoneal cavity. So these are pericardioperitoneal canal. So this is right now we are looking at the left pericardioperitoneal canal, and of course on the other side there will be the right pericardioperitoneal canal. Now in the next lecture we will see that how the diaphragm develops from the septum transversum. Actually, diaphragm develops from the multiple structures, and that is the debate of next lecture. But please keep that in mind that initially the septum transversum and of course initially the diaphragm, it is in the neck region, it is in the cervical region, and because of this the nerves that supply this developing diaphragm, they come from the cervical segments of the spinal cord. So let's suppose here is the spinal cord, somewhat here is the spinal cord. So nerves that are going to this developing septum transversum, they are the cervical nerves. They are from the cervical origin. Let's specify that C3, C4 and C5. These neurons, they combine to form a nerve called phrenic nerve. Again, we will discuss in the next lecture as well. Don't worry if you are confused about this. So C3, C4, C5, these are the cervical segments. Cervical segment 3, 4 and 5. They unite to form a nerve that is going to the diaphragm, and this nerve is phrenic nerve. So also keep that in mind that here I have illustrated that this yellowish one, I have illustrated the phrenic nerve, and it is going to the septum transversum, which will contribute towards the formation of diaphragm. And along with that, another structure that is shown here is the cardinal, common cardinal vein. So this side also, this is the left common cardinal vein. So here is anterior cardinal, there is the posterior cardinal. They will combine to form left common cardinal vein, and similar to that on the other side there will be the right. Here is the right common cardinal vein, and they are going to heart. And as you can see that I haven't shown the anatomically correct heart here in this diagram. Here I have shown that artistic heart that you have been looking throughout your life, and I haven't deliberately shown you the anatomical heart to keep the things simple, because right now our topic of discussion is not about development of heart. Our focus would be the development of pericardial cavity. Now what happens that from the foregut, the laryngotracheal diverticulum arises, which is also called lung bud. So lung bud will arise from the foregut, and if you don't know what is laryngotracheal diverticulum or lung bud, we have discussed it in detail in the respiratory system embryology. You can watch those lectures. So here let me show you. So here you can see precisely, here is this laryngotracheal diverticulum, and by the way, this laryngotracheal diverticulum, it is also covered by a layer of mesoderm, which is basically the subplanchnic mesoderm. Let me make it a bit more clear for you. So let's draw a diagram here that so here is this foregut, this tube called foregut. From this foregut, laryngotracheal diverticulum arises like this. This is the foregut. From it, laryngotracheal diverticulum arises, and this diverticulum will divide into two parts, and they are basically going to form the lungs. So like this is the laryngotracheal diverticulum. Now this part will form the trachea, this ventral part will form the trachea, and dorsal part will form the esophagus. And please note that all these structures, they are covered by intraembryonic, which layer, somatic or subplanchnic? Remember, it is covered by intraembryonic subplanchnoploric mesoderm like this. So all these structures, they are plastered by intraembryonic subplanchnoploric mesoderm like this. Please keep that in mind. So that is the structure that we are looking at. Now let's move forward. Now please note that these lung buds, they are growing into which structures? They are ingressing into which structure? Basically, they have intruded which canal? This is the pericardioperitoneal canal. Please keep that in mind, that the lung bud, initially they are growing into the pericardioperitoneal canal. Now we have these three structures, the pericardioperitoneal canals, the pericardial, primitive pericardial cavity, and primitive peritoneal cavity. Now this pericardioperitoneal canal, they will say that okay, we need some privacy, we must be separated from the other two cavities. So what will happen, that folds of tissue, they will arise, and these folds of tissue, these mesenchymal ridges or folds of tissue, they will separate these pericardioperitoneal canal from the pericardial cavity, primitive pericardial cavity, as well as from the primitive peritoneal cavity. Let me show you those folds. So here you can see that two folds arise. One of the fold, this one fold, again it is bilateral structure, please keep that in mind. So this one of the fold, it is separating the pericardial cavity, primitive pericardial cavity, from the pericardioperitoneal canal, and it is superior at this time, not later. At this time, later the things will become different. At this time it is superior to the lung bud, and this other fold, which is right now inferior to the lung bud, it is separating the peritoneal cavity from the pericardioperitoneal canal. Now because the lung bud has intruded into the pericardioperitoneal canal, the textbooks, they say that pericardioperitoneal canal is right now the primitive pleural cavity. So later on there will be another discussion that what specific structure forms the pleural cavity, but right now you just keep in mind that the primitive pleural cavity is the pericardioperitoneal canal. So bilaterally, right and left pericardioperitoneal canal, they are forming the primitive pleural cavity. So right now we have the three cavities. What are those cavities? We have this primitive, this one is the primitive pericardial cavity. Primitive, here is the primitive peritoneal cavity, and now we are calling this pericardioperitoneal canals, we are calling them as primitive pleural cavities. So these are now primitive pleural cavities. So these folds right now, they are separating the pleural cavity from pericardial cavity, and here this fold is separating the pleural cavity from the peritoneal cavity. So what should be the name of these folds? It's very logical to assume that this superior fold, this cranial fold, it is called pleuro, because this is the pleura, this is primitive pleura. So pleuropericardial fold. So this is the pleuropericardial fold. Don't forget that these are the bilateral structures. And this inferior fold, which is right now inferior or caudal to the lung bud, this is also pleurofold, and this is pleuroperitoneal. So pleuro is the common prefix, and one is separating this primitive pleura from the pericardial cavity. So this is pleuropericardial fold, and the other one is separating this primitive pleural cavity from the peritoneal cavity. So that is why this is called pleuroperitoneal fold, or it is also called pleuropericardial membrane rather than fold. Some people call it pleuropericardial membrane, and some authors, they also call this pleuroperitoneal fold as pleuroperitoneal membrane. So also please keep that in mind so that you don't get confused when you read the books. Now one thing, please keep that in mind, that at this time this pleuropericardial fold, it is sort of diagonal. It is slightly horizontal but a bit of diagonal, but later on you will see that it will become vertical like this. It will become vertical like this. So how come it becomes vertical? Let's see how. So lungs are growing further, and as we have discussed previously, the septum transversum, which is basically the precursor of diaphragm, initially it is lying within the neck region, in the cervical region, but it should descend downward, and there are many different reasons that why it descend downward. One of the reason is the lengthening of the foregut, specifically lengthening of esophagus, and there are numerous other reasons that I don't know precisely, and I won't go into that details. So let's watch the descent of diaphragm. So what happened here, that septum transversum, it descended downward, and as it happened, this pleuropericardial fold, it became slightly more vertical. Initially it was sort of horizontally placed, not exactly horizontally, I should say it was a diagonal, but it has become less diagonal and more of a vertically placed ridge of tissue. And also please note that the heart, it is pushed ventrally, and along with that, of course, its mesentery will also be pulled anteriorly or ventrally. Please note that this mesentery of heart, this dorsal mesentery of heart, most of it will be degenerated, and only the mesentery that will remain is around the major vessels. But let's assume that it is not degenerated for the sake of simplicity, because we have discussed these things previously in the cardiovascular embryology. So let's not go into that nitty-gritty details in this lecture. Otherwise, it will become quite confusing for you to understand the formation of body cavities. So let's keep the things simple. But do keep in mind that reality is not that simple. Sometimes the reality is quite complicated. To be very honest, this is quite complicated and difficult topic to teach. I have tried my best to simplify it for you, to make it simple for you. I hope I am successful in this attempt. Please share your thoughts about this lecture in the comments below. Now one thing that you must keep in mind, that the phrenic nerve as well as the common cardinal veins, they are embedded into these pleuropericardial folds. And as the septum transversum descends downward, the phrenic nerve is also pulled downwards. And that is the reason why the nerve supply of septum transversum, the nerve supply of diaphragm, although the diaphragm is between the chest and abdomen, it is quite lower structure, but its nervous supply, it is coming from the neck region, from the cervical region. This is because as the diaphragm descends downward, as the septum transversum, as it descends downward, as it changes its position, it pulls its nerve along with its positional changes. Along with the positional changes, the nerve is also descending downward. Now, if you focus on this pleuropericardial fold, you will realize that it has separated the pleural cavity from the pericardial cavity. Now, what will happen, that lung will grow further. Both of these lungs, they will grow further. And as the lung they grow, there are certain changes that occur within the, especially within this pleuropericardial fold. That these pleuropericardial fold, they are pushed ventrally, especially the root of this pleuropericardial fold. Here also you can see that. Let's watch the animation again. You will realize that the root of pleuropericardial membrane, it is pushed interiorly, ventrally. This will become much more clear when we will see the 2D section of these structures. So don't worry about that if you fail to understand. Now, what actually happened here, that initially the lung was within the pleuropericardial membrane, but as these lungs they grow, they bulge up into the primitive pericardial cavity as well. So let's let's go back and let's see here. Initially, it was only in this pericardioperitoneal canal, and what happens here? Let me demonstrate it for you. That actually initially it was only in the premises of pericardioperitoneal canal, but as the lungs grow, they bulge up, and as they bulge up, they also start growing within this primitive pericardial cavity. Now my question is that the definitive pleura, it is formed, the definitive pleural cavity, it develops from what structures? And you have two options. One is the primitive pericardioperitoneal canal, and the other option is the primitive pericardial cavity, specifically the dorsolateral part of primitive pericardial cavity. The right answer is that both of these structures, they contribute to definitive pleural cavity. And you get confused that initially some authors say that primitive pleural cavity is the pericardioperitoneal canal, and then even in the same book, sometime later you will see that there is written that the dorsolateral part of primitive pericardial cavity contributes towards the formation of pleura. So actually both of these structures are contributing to formation of it, but initially, because initially the lung bud, initially they are residing into pericardioperitoneal canal, so that is why typically we call that pericardioperitoneal canal. It is going to form the pleura. Now I want to hide the lungs and I want to show you something. Let's hide the lungs. Now just focus on this pleuropericardial fold and the heart. You will observe that as its root, here are the roots, this one and this one as well. As the roots of these pleuropericardial folds, as they move ventrally, they will sort of hug the heart very nicely and tightly. They will hug the heart and they will form another protective covering of the heart, and that is that tough fibrous protective covering of the heart, the outer protective covering, that is termed as fibrous pericardium. Inside that is the membranous pericardium, and outside is the fibrous pericardium. These things will become more clear in the later part of this lecture, but first let's watch the animation again so that you can understand how this fibrous pericardium develops. So now you must be very clear that how these pleuropericardial folds, they surround the heart to form the fibrous pericardium. And please keep that in mind, that because the phrenic nerve was embedded into this pleuropericardial folds, as these folds, as they form the fibrous pericardium, this phrenic nerve, it still continued to pass through the fibrous pericardium. And that is why in the adult, if you see the anatomy of a phrenic nerve, you will realize that this phrenic nerve, it actually passes through the fibrous pericardium. Now what I will do is that we will take a 2D section of this 3D model and we will observe that 2D section. So let's suppose that we diagonally cut it like this. We cut this embryo like this diagonally and sort of like this, and then we observe it, and I hope you can understand what I mean by this, what I am exactly trying to show. So this is the section that we will cut and we will observe that section like this. So here is that section, and by the way, here is the neural tube. This is the neural tube. This is the ectoderm, the outer ectoderm, and here is this GI tube. So here is the GI tube. From GI tube, the lung bud has arisen, right lung bud and left lung bud. And surrounding this, both of these structures is this subplanknopleuric, intraembryonic subplanknopleuric mesoderm, and from here here is the dorsal mesentery of heart, which is surrounding the heart like this. Here again subplanknopleuric intraembryonic mesoderm, and it is now continuing dorsally as the intraembryonic somatic mesoderm, which is inner lining. Inside it is lining the body wall. So intraembryonic somatopleuric mesoderm. So let's see what happened. So first we will see how the pleuropericardial fold forms. That is the topic of discussion mainly today. So what actually happened that from this ectoderm, some cells, they divided, they proliferated, and they transitioned into irregularly shaped mesenchymal cells, and these mesenchymal cells, they went sort of inside, inward, and as it happened, they sort of taken up a layer of intraembryonic somatic mesoderm. This layer of intraembryonic somatic mesoderm, it surrounded this mesenchymal ridge, this ectodermal origin mesenchymal ridge. So that's how this pleuropericardial fold forms. So it has dual origin ectoderm as well as the intraembryonic somatic mesoderm. Let me show you diagrammatically. So here we have the ectoderm. Let's suppose here is the ectoderm. So from ectoderm is actually consist of the epithelial cells. So some of these epithelial cells, these nice and properly shaped epithelial cells, some of them, they proliferated and they lost their specific shape like this. So as they lost their shape, and along with that, initially they are from inside, they were covered by the somatic mesoderm. So somatic mesoderm, at the site of formation of this mesenchymal ridge, somatic mesoderm will be lifted upward, and as it will be lifted upward, it will form the part, it will become sort of a component of this fold. So ultimately what will happen that a proper structure, a proper fold is formed, that initially there is this epithelium, ectodermal epithelium, then there is the mesenchyme. There is that mesenchyme which has the origin from this ectoderm, and this mesenchyme, it is covered by the intraembryonic somatic mesoderm, somatopleuric mesoderm, this lifted layer of intraembryonic somatopleuric mesoderm like this. Oh my god, I don't know why suddenly it has assumed the shape of a penis, but don't assume that it is penis, it is the pleuropericardial fold. So that's how the pleuropericardial fold forms. Next, what happens that this lung, here is that lung, what happens that this lung, it will sort of bulge inside this, into this root of pleuropericardial fold, and some authors say that the lung bud, it is sort of bulging into the lateral body wall. So here is the lateral body wall, so it is sort of bulging into the lateral body wall somewhat here, and as it will exert pressure bilaterally, of course, as it will exert the pressure at the lateral body wall at the root of this pleuropericardial fold, what will happen that this root of pericardial fold, it will be translocated ventrally. So initially it was here, but it will be translocated ventrally and it will come to lie somewhat here. And as it will come to lie somewhat here, its shape will become like this. And as its shape will be transformed, it will go on to surround the heart to form the fibrous pericardium. Let's watch the animation so things will become more clear. So here you can see how it exactly, this was that lung, but how it bulged into the lateral body wall, and this lateral body wall, it caused this movement, this translocation of this root. Here is this root of pleuropericardial fold. This root is shifted ventrally, and now you can see what actually happened here. This is actually the fibrous pericardium. Let me label these structures for you so it will become easier for you to understand. So this one is this one is this tough fibrous pericardium. This is a protective layer. This is the fibrous pericardium, and inside this fibrous pericardium, here is the somatic layer. This one is the intraembryonic somatic layer, intraembryonic somatopleuric mesoderm, and it continues as intraembryonic subplanchno-pleuric mesoderm. And between these two layers, this small potential cavity, it is a fluid filled cavity. This cavity between these two layers, this cavity is called pericardial cavity. So initially that pericardial cavity was huge, it was humongous, but now it has become very small. Now actually this intraembryonic somatic mesoderm, this structure, this layer that was formed by the intraembryonic somatic mesoderm, it is actually called the parietal layer of pericardium, parietal layer of membranous pericardium, because there is that fibrous pericardium. So to differentiate it from the fibrous pericardium, this is called parietal layer of which pericardium? Parietal layer of membranous pericardium, because it's a smooth membrane. And this other layer, this inner one, is the somatic layer, and it is also called visceral layer. So this is the visceral layer of membranous pericardium. Now one thing that is very important to understand here, that here you can see this pleuropericardial fold. As these pleuropericardial fold, right and left pleuropericardial fold, as they meet in the midline, their free margin, here is the free margin, right and left both free margin, as they come close together, their free margin, they will meet in the midline, in the central midline. And as their these folds, as they meet in the central midline, they will disrupt the continuity of this dorsal membrane of the heart, not membrane, dorsal mesentery of heart, like this. So previously this dorsal mesentery of heart, it was connected to this foregut. It had that connection with the foregut, but as the fibrous pericardium is formed, this connection is lost, and now it is only connected to the parietal layer of its membranous pericardium. So do keep that in your mind. Now if I tell you that in this diagram there is a mistake, can you point out what is the mistake? The mistake is that there is only a single tube here. Actually, it should be like this. Let me exactly show you. So here is the foregut, and from foregut, that's laryngotracheal diverticulum or lung bud arises, and ultimately these two will fuse like this, and ultimately two separate tubes will be formed. The dorsal one will be the esophagus, and ventral one will be the trachea. So here should be actually two tubes. The dorsal one somewhat here should be the esophagus, and ventral one should be the trachea. So please keep that in your mind. So that was about the formation of pericardium and pleura. I hope you liked this video. Thank you so much for watching this video.